Good morning. It's such a pleasure to be here today, and I'd really like to thank USAID and RTI for giving me this opportunity to be with you, albeit virtually, this morning. It's such a pleasure to be able to share some of the lessons that we've learnt in the UAE here around returning to school with COVID-19. My name is Dr. Natasha Ridge, and I'm the Executive Director of the Qasimi Foundation for Policy Research. I'm based in Ras Al Khaimah in the UAE, and I've been working in the education sector now for for over 20 years, my age is showing, but in the UAE itself, around 20 years. First as a teacher, then as a head of department, and now much more in the policy-making sphere. So it's a great pleasure, as I said before, to be here, and we're really looking forward to sharing some of the lessons that we've learned, some of the challenges that we've faced as we've reopened schools here in the UAE post the peak of the pandemic. So in the UAE, we've been moving towards face-to-face classes for quite a while in 2021, but in September of this year, when the school year opened, or depending on which was the system, but roughly September, all schools went back to face-to-face instruction as per instructions from the Ministry of Education. This was a big change, obviously. We've been seeing some mixes of virtual and hybrid learning up until that point, but actually that the UAE made the decision that we really need to get students back into classrooms for a whole host of reasons, not least of all the social and emotional isolation that was happening with so much online learning. So in terms of preparations that we made to get students back to school safely, a number of things were done. First of all, schools had been sanitized thoroughly before anyone else returned to the building. So there was first of all that basic safety measure of going through the schools of a big clean, of a sterilization of the school environment itself. Secondly, the UAE has been embarking on a very ambitious vaccination campaign for students and for teachers and for parents as well, for all citizens in fact, and that formed a very big part of being able to return to school safely. Alongside of that, there was instructions about the wearing of masks so that students would be safely not spreading contagion in the classroom, and teachers as well. Also social distancing, which was very helpful, but at the same time that posed some challenges, which I'll talk about in a minute. And finally, what I think has probably been the most important component of this, which has been regular PCR testing. So something that the UAE has really excelled in is regular testing for all the citizens and all students and teachers. And by combining the vaccination, the social distancing, the sanitization with regular testing, we're much more able to stay on top of the spread of the disease and to isolate students quickly rather than waiting for it to already have spread into another mini wave of infection in a school or a classroom. So obviously there were challenges encountered with this. I think if we divide those up into a couple of categories. So the first category that we talk about is logistical challenges. And I think this is where we talk to things that are probably more relevant, I guess, for the Philippines context, which is how do schools that cater largely for low-income students meet all these requirements and help parents who perhaps are struggling economically to meet all these requirements? How do you have social distancing in a school that was already overcrowded pre the pandemic, and now with many schools closing due to lack of profitability in the UAE, even more demand on existing schools and existing facilities? The biggest challenge was really this idea of social distancing. How do you have fewer students in a classroom if in fact there is no space in the school to do so? Some schools that were using gymnasiums, some schools were using any other kind of hall, some were using outdoor areas in order to space students out. But that also then posed a problem for teachers. If you only have one teacher per 25 or 35 or 40 students, they can't actually be in two places at one time. So you might socially distance the class, having, say, 20 here and 20 there, but you only in fact have one teacher. So the teachers sometimes in some of these schools were forced to be running between two different groups of students, perhaps with a teaching assistant, perhaps not. So this really affected the low-income schools the most. Wealthier schools with higher teacher-student ratio numbers were obviously able to adapt a lot faster and a lot easier to this kind of thing. But for the low-income students and the low-income schools, low-fee schools, this was a massive challenge, and it's remained a challenge. You know, those were the most impacted students from the pandemic with the largest losses of learning, but their schools are also the schools with the least number of facilities and teachers and all the other ancillary staff that are needed. So that was a really, really big challenge. Another challenge was the PCR testing in terms of who pays. So while PCRs are free for citizens and things, for the low-income students who are not citizens, families have to meet the cost of those PCRs. And there might be a free PCR centre in the region, but there might not be. So it really depends how close, how much access they had to that and how easy it was to get there. Did they have a car? Could they drive there? Was it in walking distance? If they had to pay, could they afford it? So there was also concerns about that. So some schools, especially in Ras Al Khaimah, we have charity schools funded by the government. The teachers, the school itself would meet the cost of the PCRs and would also organise the testing of students to help these families who really either couldn't get to the centre or couldn't afford to pay, or any of the challenges around that. So it's quite a real issue for low-income students about not just the space in school and how do schools cope, but also testing and I guess even if you think the cost of buying masks and those kind of things. Like there's a lot of additional costs that students faced. Then if we turn to the learning challenges, I mean, they were also quite significant as well. And again, mostly impacting students from low-income families and who attend low-fee schools. So some of those things, first of all, there's often been most schools have maintained some kind of online component. They've maintained a hybrid approach. Although students might be in the classroom, you'll see a lot of images of students in a classroom but still behind a screen, which has its own problems obviously as well. But for many students in low-income schools, they often they might have had one laptop per family. They certainly didn't have a laptop per child. So this has been an issue, just how can they access learning if it's now being delivered online and they don't even have a device on which to access it. So this has been a massive issue. Connected to that is connectivity. How can you access online learning if maybe you don't have an internet connection in your house, or maybe you share it with 2 other families or 3 other families all living in one villa? How does that happen? So when students would go home, how did they access the homework if everything was online? How did they access the lessons or the things they needed to study? So while technology was a great savior in a sense for many families and schools around the world, the assumption that everyone could be online was actually very flawed. And I know that you've definitely seen that in the Philippines, we've seen it in UAE, and we've seen it all over the world, where students whose families are not connected really suffered great learning losses. In addition to that, we also saw mental and emotional issues arising around learning. Students who had been isolated for much of the pandemic often can feel very fearful about coming back to school and about being around people so much. A story, in Australia, not from here, but my nephew went to play on a play date, and the little girl was very excited to be seeing for the first time. They were 5 years old, they're going back to school. But she hadn't seen any other children for over 6 months nearly. And when she saw my nephew, she actually ran away and hid because she became so afraid of another child. And I think this is something that's very common around the world, that we're seeing children want to be together, but they're afraid. And so the mental health implications that we're seeing are just enormous. And that's not just for the children. I mean, if we think about the teachers as well, many teachers have been doing online learning for a larger time during the pandemic. They've also become accustomed to less contact, less people. And so for many of the teachers themselves, there's a lot of anxiety around returning to school, around being around a lot of children. So some of the big challenges that we're facing here in the UAE and globally is that issue of mental health. It's not just enough to be going back and learning and vaccines and testing and masks, but how have we been conditioned to think differently about social interaction? And I think this is something that we'll all need to consider as we go forward with reopening schools. So after outlining all of those challenges, how did we deal with those? So what sort of things did we do to overcome some of these challenges? Well, I think a big part of the approach here in the UAE is been working with parents. How do we bring parents along? I think one thing that COVID revealed was that for some parents, they'd been very absent from their educational journey of their children, if you were. I mean, there was a time in the past where parents were very involved, but I think we've seen less so. But once students all had to learn from home, we found that parents suddenly realized, oh my goodness, I have to be involved a lot, much more than I've ever been involved in the past. So some of the good things as we return to face is one that we've established different connections with parents than we had in the past. Parents now are much more aware and informed about what their children are doing, in the most part. So working with parents, helping parents understand how to use technology, what kind of things, how do we use technology safely, how do we use technology proportionately. So giving education to parents, working with parents, seeing parents now much more, as they always should have been, as partners in the educational journey. Another thing that's happened is also to help provide additional resources to students, especially those from low-income families, to provide laptops or notebooks, or even to go so far as to providing connectivity to homes in those who really did not have any. So there has been a targeted approach through foundations, through government sector, through community associations. How do we help support those families in need? So that's been a very, very important part of that. Also more training for teachers and more support for teachers on this virtual thing, but also again on health and wellness. And we've seen a great demand in the mental health first aid certificate, which is now offered here, especially the one for adolescents. And there's a peer-to-peer one where adolescents can actually be mentoring and watching their peers and seeing how their mental health is. So that's also been a very important component of as we go back to school and overcoming some of these challenges. So, to sum up everything, how can we really get back to face? What are the most important considerations? I think here in the UAE, the biggest takeaway, I would say, from the whole pandemic that links also to face-to-face return to anything actually, is regular testing and isolating of people who have symptoms. So that's something that we've been doing well. I think what we're looking though now is how to have different forms of less invasive testing, especially for younger children, such as saliva rapid antigen tests that are more mouth-based swabbed rather than through the nose, or that they can just spit on. We've got a saliva testing as well. So really looking at more innovative ways to do rapid testing, I think, is critical to going forward and ensuring that schools are safe places. Secondly, helping children to reconnect safely. So where possible to have social distancing, but also how to help children still go back to enjoying playing together, being with each other. How do we help students with that? How do we help them readjust? And how do we help teachers adjust as well? Some of the other things we've done is like lunch boxes now in cafeterias. One of the big challenges is how do you distribute food safely? So one thing is now that just a lunchbox where they're given a lunchbox straight away, it's just one box, all their food's in it. So it limits contact. Again, we're limiting contact all the time. Other things such as in the washrooms, having taps that turn on with just the swipe of the hand versus touching all the time. So limiting touch as much as possible, as where many children will be touching the same things. Some things that have been also trialled is additional time for students who have missed a lot of learning, in particular those from low-income families. Private tutoring for those. Sometimes we could have extended school days. Also take-home learning kits that they could work on at home that are not in front of a screen again. Another big challenge and something that we really want to think about as we go back is the need for physical education. How do we reintroduce extracurricular activities, the arts, PE, music? How do we get children moving again, expressing again, drama? All these things which have been put on hold through the pandemic, but all these things which are, which make us human, which we need for not just healthy lives, but also to connect and to thrive in society. How do we reimagine those things in a safe but no less vibrant way? So these are some of the things we're thinking about. I'm sorry I don't have a lot of answers here, but probably more thoughts than answers. And I think reevaluating technology. Technology usage has been in some ways a great savior of the pandemic, but in many ways it's only exacerbated isolation. It's wear and tear on physically, especially on eyesight. I can testify to that, or it could be my aging eyes. But it's these things that really challenge us. How do we connect together as humans face to face? How do we bring our children and our teachers and our principals and our parents back into real community, into physical community, not just online communities. And I think that's going to be challenges for policymakers the world over. But I think if anything that we've learned is that the school remains the sort of the heartbeat of a society and of a community. We always talked about teacher-proof schools in the past. As a former teacher, I never liked this, but it's teachers we see now. No one can replace a teacher, and certainly technology cannot replace a caring and kind and involved teacher. And I think, if anything, taking care of our teachers, supporting our teachers, and investing in our teachers is going to be the critical path out of this pandemic. So I'd just like to thank you all so much. I'm really sorry I couldn't be in there face to face. That would be so much nicer. But I wish you all the best with the symposium. And please feel free to email me any questions that you might have. If you want to get in touch, Marisol has my email address, so you can be in touch with me through email or on LinkedIn. I'd just really like to thank Marisol. She's just been wonderful in setting all this up. And again, USAID and RTI for this wonderful opportunity. I wish you all the best, and I look forward to meeting again in person soon. Thank you.